Are the pills you're taking right now secretly damaging your heart? Every day, millions of people take medications without realizing they might be putting their hearts at risk. From simple pain relievers to diabetes medications, certain drugs could be silently increasing your chance of a heart attack, and the consequences can be life-threatening. Some of the most commonly used medications, like NSAIDs, ibuprofen, naproxen, hormonal contraceptives, and even over-the-counter decongestants, have been linked to high blood pressure, blood clots, irregular heart rhythms, and even heart failure. Even medications prescribed for diabetes and depression could have unintended cardiovascular risks. Shocking fact. Did you know that some painkillers can raise your heart attack risk within just a few weeks of use? Or that certain antidepressants may disrupt your heart's rhythm, increasing the likelihood of sudden cardiac events? These risks are often overlooked or underestimated, leaving many people unaware of the danger lurking in their medicine cabinet. But don't panic. Awareness is the first step toward protection. By understanding the hidden dangers of these 7 medications and learning about safer alternatives, you can make informed choices and protect your heart health. Stay informed. Watch until the end to protect yourself and your loved ones. If you're serious about your health, hit that subscribe button and turn on notifications. Your heart deserves the best care. Don't let an unexpected side effect put your life at risk. Stay tuned as we reveal the 7 medications you should be cautious about, and what you can do to stay safe. Hormonal contraceptives. Are they putting your heart at risk? For decades, hormonal contraceptives have been a reliable method of birth control, offering women convenience and control over their reproductive health. However, while these medications are effective in preventing pregnancy, they may carry serious hidden risks, particularly for heart health. The risk: combination hormonal contraceptives, which contain both estrogen and progestin, come in various forms, including pills, patches, and vaginal rings. While they regulate the menstrual cycle and prevent unwanted pregnancies, they can also increase the risk of blood clots. These clots can form in major arteries, leading to heart attacks, strokes, and other cardiovascular complications. The reason behind this risk lies in how estrogen affects blood clotting mechanisms. Estrogen increases the production of clotting factors in the blood, making it more likely for clots to form and block blood vessels, a condition known as thrombosis. The real concern: studies have shown that women using estrogen-progestin contraceptives face twice the risk of a heart attack compared to non-users. The risk is even higher for those with additional predisposing factors such as smoking, high blood pressure, diabetes, or obesity. Furthermore, certain forms of contraception may be riskier than others. Research has found that vaginal rings and patches may have an even higher cardiovascular risk than oral contraceptive pills, as they introduce a higher concentration of hormones directly into the bloodstream. Who is most at risk? Women over 35 years old, smokers, or those with a family history of cardiovascular disease should be especially cautious when using estrogen-based contraceptives. Even younger women with no pre-existing conditions should be aware of potential risks and discuss their options with a healthcare provider. A safer alternative: fortunately, there are lower risk options available. Progestin-only contraceptives, such as the progestin-only pill, mini pill, injections, implants, or intrauterine devices, IUDs, provide effective birth control without significantly increasing clotting risks. Among these, the progestin-only IUD has been found to be one of the safest choices for women concerned about cardiovascular health. If you are using hormonal contraceptives or considering them, it's crucial to weigh the benefits against the risks. Always consult a doctor to determine the best and safest option for your individual health profile. The hidden heart risks of NSAIDs. Are your painkillers putting you in danger? Millions of people worldwide rely on non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, naproxen, and diclofenac to relieve pain, reduce inflammation, and manage fevers. These medications are commonly used for headaches, arthritis, muscle pain, and menstrual cramps. However, while they may seem harmless, research has shown that frequent or prolonged use of NSAIDs can increase the risk of heart attacks and strokes. even in people without pre-existing heart conditions. How NSAIDs increase heart attack risk. NSAIDs work by blocking cyclooxygenase (COX) enzymes, which are responsible for producing prostaglandins, chemicals that trigger inflammation, pain, and fever. While this effect helps relieve discomfort, it also disrupts the delicate balance between blood vessel constriction, platelet aggregation, and clot formation. When this balance is disturbed, blood vessels may constrict excessively, increasing blood pressure and straining the heart. Platelets may clump together more easily, making blood clots more likely to form. The risk of thrombosis, blocked arteries, rises, which can trigger a heart attack or stroke. Even short-term use can be dangerous. The FDA has issued warnings that heart risks can begin within just a few weeks of NSAID use. Even at normal doses, the longer you take NSAIDs and the higher the dose, the greater the risk of cardiovascular complications. Who is most at risk? Certain individuals face an even greater threat when using NSAIDs, including people with high blood pressure. NSAIDs can cause fluid retention and raise blood pressure, increasing heart strain. Those with existing heart disease or a history of stroke. The risk of heart attacks and strokes is significantly higher in people with pre-existing cardiovascular conditions. Older adults, as we age, our cardiovascular system becomes more vulnerable, making NSAID-related heart risks even more concerning. Are all NSAIDs equally risky? While all NSAIDs carry some level of cardiovascular risk, not all are created equal. Studies suggest that diclofenac poses the highest risk, while naproxen appears to have a more favorable heart safety profile compared to other NSAIDs. However, naproxen should still be used cautiously, especially in people with underlying heart concerns. Safer alternatives for pain relief. If you need pain relief but are concerned about your heart health, consider alternative options. Acetaminophen, Tylenol, a good option for pain relief that does not carry the same cardiovascular risks as NSAIDs. Physical therapy and lifestyle changes, exercise, stretching, and proper posture can help reduce chronic pain. Natural anti-inflammatory remedies, turmeric, ginger, and omega-3 fatty acids have been shown to reduce inflammation safely. Use NSAIDs wisely. While NSAIDs are effective, they should be used with caution, especially if you have high blood pressure, heart disease, or other cardiovascular risk factors. Always take the lowest effective dose for the shortest possible duration and consult a healthcare professional before long-term use. Protecting your heart should be just as important as relieving your pain. The hidden cardiovascular risks of thiazolidinediones. Are your diabetes medications endangering your heart? For individuals managing type 2 diabetes, medications play a crucial role in regulating blood sugar levels and preventing complications. However, not all diabetes drugs are equally safe. Some may pose serious risks to heart health. One class of diabetes medications, thiazolidinediones, TZDs, including rosiglitazone and pioglitazone, has been linked to an increased risk of heart attacks, heart failure, and fluid retention, raising concerns among healthcare professionals. How thiazolidinediones work, and why they can be dangerous. TZDs function by activating peroxisome proliferator activated receptor gamma, PPAR gamma, which enhances insulin sensitivity in muscle and fat cells. This helps lower blood glucose levels and improve metabolic function. However, while TZDs effectively reduce blood sugar, they also alter fluid balance, fat distribution, and cardiovascular function in ways that may be harmful. The major concerns associated with TZDs include increased risk of heart attacks. A widely cited meta-analysis published in the New England Journal of Medicine found that rosiglitazone users had a 43% higher risk of heart attacks compared to those on other diabetes medications. This alarming statistic has led to regulatory warnings and restrictions on the drug's use in multiple countries. Higher risk of heart failure. TZDs can cause the body to retain excess fluid, leading to swelling, edema, increased blood pressure, and additional strain on the heart. This significantly raises the likelihood of heart failure, especially in those with pre-existing cardiovascular conditions. Potential for weight gain and fat redistribution. TZDs promote fat storage, sometimes leading to weight gain, which can further exacerbate insulin resistance and cardiovascular stress. Who should be most concerned? Individuals at higher risk of cardiovascular disease, including those with a history of heart failure or previous heart attacks, high blood pressure or chronic kidney disease, excess fluid retention or significant weight gain while on TZDs. Safer alternatives for diabetes management. The good news is that safer diabetes medications exist, offering effective blood sugar control without significantly increasing cardiovascular risks. Metformin, the first-line treatment for type 2 diabetes. Metformin is associated with cardiovascular benefits, including lower risks of heart disease and improved weight management. SGLT2 inhibitors, e.g. empagliflozin, canagliflozin. These drugs help lower blood sugar while also reducing heart failure risks and promoting weight loss. GLP-1 receptor agonists, e.g. liraglutide, semaglutide. These medications lower cardiovascular risks while supporting better glucose control and weight management. Prioritize your heart while managing diabetes. If you're currently taking rosiglitazone or another TZD, consult your doctor to discuss safer alternatives, especially if you have a history of heart disease, high blood pressure, or fluid retention. Managing diabetes is about more than just controlling blood sugar, it's about protecting your overall health, including your heart. Making informed choices today can lead to a longer, healthier future. The hidden heart risks of antidepressants. What you need to know. For millions of people worldwide, antidepressants are a lifeline, helping to manage depression, anxiety, and other mood disorders. However, while these medications are essential for mental well-being, some may come with unexpected cardiovascular risks, especially for those with pre-existing heart conditions. Certain antidepressants, particularly tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, have been linked to irregular heart rhythms, increased heart rate, and blood pressure fluctuations. How antidepressants affect the heart. Tricyclic antidepressants, TCAs, this older class of antidepressants, including amitriptyline, nortriptyline, and imipramine, works by inhibiting the reuptake of serotonin and norepinephrine, increasing their levels in the brain. However, TCAs also have strong effects on the heart, such as irregular heart rhythms, arrhythmias. TCAs can prolong the QT interval on an ECG, increasing the risk of dangerous heart rhythm disturbances. Increased heart rate, tachycardia. These drugs affect the autonomic nervous system, sometimes leading to a persistently high heart rate, which can put strain on the heart. Blood pressure drops, orthostatic hypotension. TCAs can cause a sudden drop in blood pressure when standing up, leading to dizziness and an increased risk of falls, particularly in older adults. Selective serotonin reuptake inhibitors, SSRIs. While SSRIs like fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, are generally safer for the heart than TCAs. Some carry cardiovascular risks. QT prolongation in arrhythmias. Citalopram and escitalopram have been found to prolong the QT interval, which can increase the risk of a life-threatening arrhythmia called torsades de pointes. Mild effects on blood pressure. While rare, some SSRIs may slightly lower blood pressure, leading to lightheadedness and dizziness, especially in seniors. Why seniors need to be extra cautious. Older adults are especially vulnerable to the cardiovascular effects of antidepressants due to aging-related changes in heart function. The heart and blood vessels become more sensitive to medications as we age. Higher risk of falls. TCAs and certain SSRIs can cause dizziness, low blood pressure, and sedation, increasing the likelihood of dangerous falls and fractures. Multiple medications, polypharmacy. Many seniors take heart medications that may interact with antidepressants, exacerbating cardiovascular side effects. Safer antidepressant options. For individuals with heart concerns, doctors often recommend SSRIs with a better cardiovascular safety profile, such as sertraline, Zoloft, considered one of the safest SSRIs for those with existing heart conditions. Fluoxetine, Prozac, generally well tolerated with minimal effects on heart rhythm. Bupropion, Wellbutrin, unlike SSRIs and TCAs. Bupropion has no significant impact on heart rhythms and may be a good alternative for some patients. Balance mental and heart health. If you are taking antidepressants and have a history of heart disease, high blood pressure, or arrhythmias, speak with your doctor about safer options. While treating depression is crucial, choosing the right medication can help protect both your mental health and your heart. Never stop medication suddenly. Always discuss any concerns with a healthcare professional to find the best and safest treatment for your needs. Pseudoephedrine and heart risks. What you need to know. Pseudoephedrine is a common ingredient found in many over-the-counter cold and allergy medications, helping people relieve nasal congestion caused by colds, flu, and seasonal allergies. While it is an effective decongestant, pseudoephedrine can pose serious risks to heart health, particularly for individuals with existing cardiovascular conditions. Many people take these medications without realizing they can cause increased blood pressure, irregular heart rhythms, and even sudden heart attacks. How pseudoephedrine affects the heart. Pseudoephedrine works by stimulating alpha-adrenergic receptors, which causes vasoconstriction, or the narrowing of blood vessels. This helps reduce swelling in nasal passages and allows for easier breathing. However, this vasoconstrictive effect does not just target the nasal passages, it also affects blood vessels throughout the body, leading to increased blood pressure and strain on the heart. In some individuals, pseudoephedrine can trigger elevated blood pressure hypertension. The narrowing of blood vessels forces the heart to pump harder, which can increase blood pressure. Heart arrhythmias, irregular heartbeats. Some users experience palpitations, rapid heartbeat tachycardia, or skipped beats, which can be dangerous for people with existing heart disease. Increased risk of heart attacks by placing extra strain on the heart. Pseudoephedrine may increase oxygen demand, potentially triggering a heart attack in those at risk. Real cases. Sudden heart attacks linked to pseudoephedrine. There have been documented cases of individuals experiencing sudden cardiac events after taking pseudoephedrine, especially in those with underlying heart conditions. Some studies suggest that even healthy individuals could be at risk if they take high doses or use these medications frequently. People who should be most cautious when using pseudoephedrine include those with high blood pressure. The medication can cause sudden spikes in blood pressure, making it particularly dangerous for people with hypertension. Individuals with heart disease or arrhythmias. Pseudoephedrine can increase the risk of irregular heartbeats or worsen existing heart conditions. Older adults. As the cardiovascular system ages, it becomes more sensitive to stimulant-like medications. Safer alternatives for cold and allergy relief. If you are concerned about the potential heart risks of pseudoephedrine, consider using safer alternatives. Non-decongestant allergy medications. Antihistamines like loratadine, Claritin, or cetirizine Zyrtec can relieve allergy symptoms without affecting blood pressure. Saline nasal sprays. These help clear nasal congestion naturally without the risks associated with decongestants. Steam therapy or humidifiers. Breathing in steam can reduce congestion and help open nasal passages without medication. Protect your heart while managing symptoms. Although pseudoephedrine is effective for temporary relief from nasal congestion, it is important to be aware of its potential impact on cardiovascular health. If you have a history of heart disease, high blood pressure, or arrhythmias, consult a doctor before using medications that contain pseudoephedrine. Opting for safer alternatives can help you manage cold and allergy symptoms while keeping your heart protected. Corticosteroids and heart risks. What you need to know. Corticosteroids such as prednisone and dexamethasone are widely prescribed to treat inflammation, asthma, allergies, and autoimmune diseases, while they can be life-saving for individuals with severe inflammatory conditions. Their long-term use has been linked to serious cardiovascular risks. Many people take corticosteroids for extended periods without realizing they may contribute to high blood pressure, weight gain, and an increased risk of heart disease. How corticosteroids affect the heart. Corticosteroids work by reducing inflammation and suppressing the immune system, which helps manage conditions such as rheumatoid arthritis, lupus, and asthma. However, they also have several side effects that can negatively impact heart health, especially when used for long durations. Some of the major cardiovascular risks associated with corticosteroids include high blood pressure, hypertension. These medications can cause fluid retention and increased sodium levels, which raises blood pressure and puts extra strain on the heart. Weight gain and obesity. Corticosteroids can increase appetite and fat accumulation, leading to unhealthy weight gain, which is a major risk factor for heart disease and diabetes. Increased blood sugar levels. Long-term steroid use can lead to steroid-induced diabetes, which further raises the risk of heart attacks and strokes. Heart failure. By causing fluid retention and swelling edema, corticosteroids make the heart work harder, increasing the risk of heart failure over time. Hidden risks of long-term corticosteroid use. One of the biggest concerns with corticosteroids is that many patients remain on them for extended periods without realizing the cumulative impact on their cardiovascular health. Even low doses taken over time can gradually increase the risk of hypertension and heart disease. Patients with pre-existing heart conditions may experience worsening symptoms due to increased fluid retention. Abruptly stopping corticosteroids can cause withdrawal effects, including severe fatigue and blood pressure fluctuations. Who should be most concerned? Individuals with high blood pressure, heart disease, or diabetes should be especially cautious when taking corticosteroids. Additionally, older adults and those already struggling with obesity may face an even greater risk. Safer alternatives for managing inflammation. If you require corticosteroids for a chronic condition, consider discussing safer strategies with your doctor. Short-term use whenever possible. Using corticosteroids for the shortest necessary duration can reduce risks. Lifestyle changes, a heart-healthy diet, regular exercise, and weight management can help reduce inflammation naturally. Alternative anti-inflammatory treatments, options such as NSAIDs, biologic therapies, or natural supplements like turmeric and omega-3 fatty acids may offer benefits with fewer heart risks. Protecting your heart while managing inflammation. While corticosteroids provide effective relief for many inflammatory conditions, their long-term impact on heart health should not be ignored. If you take prednisone, dexamethasone, or other steroids regularly, speak with your healthcare provider about ways to reduce your cardiovascular risk. Managing inflammation safely means not only treating your condition but also protecting your heart for the long term. Proton pump inhibitors and heart risks. What you need to know. Proton pump inhibitors or PPIs such as omeprazole, pantoprazole, and esomeprazole are widely used to treat acid reflux, gastroesophageal reflux disease (GERD), and stomach ulcers. These medications are highly effective at reducing stomach acid, providing relief from heartburn and preventing complications like ulcers and esophageal damage. However, while PPIs offer significant benefits, long-term use has been linked to serious health risks, including an increased chance of heart disease, strokes, and kidney problems. How PPIs may affect heart health. PPIs work by blocking an enzyme in the stomach lining that produces acid, reducing the acidity in the stomach. While this helps manage acid-related conditions, research has suggested that prolonged use of PPIs may contribute to cardiovascular issues in several ways. Increased risk of heart attacks. Some studies have found that long-term PPI users may have a higher chance of heart attacks, even in individuals without pre-existing heart disease. Researchers believe this may be due to PPIs reducing nitric oxide production, which is essential for maintaining healthy blood vessel function. Reduced nitric oxide levels can lead to vascular inflammation and increased risk of blood clots. Higher likelihood of strokes. The effect of PPIs on blood vessels may also increase the risk of strokes, particularly in individuals with high blood pressure or other cardiovascular risk factors. Potential for kidney disease. Some research has linked prolonged PPI use to chronic kidney disease, which can indirectly impact heart health by contributing to high blood pressure and fluid retention. The hidden risks of long-term PPI use. Many people take PPIs daily for years, often without being aware of the potential long-term consequences. The concern is that PPIs were originally intended for short-term use, but many individuals continue using them indefinitely without considering alternatives. Some studies suggest that even healthy individuals using PPIs long-term may face a higher risk of heart problems. People who take high doses of PPIs for extended periods may have an even greater risk of cardiovascular issues. Long-term PPI use has also been associated with a higher risk of osteoporosis and vitamin deficiencies, further impacting overall health. Who should be most concerned? Individuals at higher risk for heart disease, strokes, or kidney problems should be cautious about long-term PPI use. Those with high blood pressure or a history of heart disease may be more vulnerable to the cardiovascular effects of PPIs. Older adults are more likely to be prescribed PPIs long-term, increasing their risk of complications. Patients taking PPIs alongside other medications that affect heart health should consult their doctors about possible interactions. Safer alternatives for managing acid reflux. If you are concerned about the risks of long-term PPI use, consider discussing safer options with your healthcare provider. H2 blockers such as famotidine. These medications can help reduce stomach acid without the same long-term cardiovascular risks associated with PPIs. Lifestyle changes, adjusting your diet, avoiding late-night meals, and elevating your head while sleeping can help manage acid reflux naturally. Short-term PPI use when necessary, if PPIs are needed. Using them for the shortest duration possible can reduce the risk of side effects. Protect your heart while managing acid reflux. While PPIs can provide essential relief for acid-related conditions, their potential long-term impact on heart health should not be ignored. If you have been using omeprazole, pantoprazole, or similar medications for an extended period, speak with your doctor about alternative treatments. Protecting your heart should always be a priority, and making informed choices about medication use can help safeguard both your digestive and cardiovascular health. Protect your health by making informed medication choices. Medications play a vital role in managing various health conditions, from pain relief to diabetes control and mental health support. However, as we have seen, some commonly used medications may carry hidden cardiovascular risks that many people are unaware of. While these drugs can be essential for treating medical conditions, understanding their potential side effects and exploring safer alternatives can help protect your overall well-being. Key reminders for safe medication use. Never stop taking a medication without consulting your doctor. While some drugs may pose risks, stopping them suddenly can lead to serious withdrawal effects or worsening health conditions. Always speak with a healthcare professional before making changes. If you are on any of these medications, ask your doctor about safer alternatives. Many drugs have lower risk options that provide similar benefits with fewer potential side effects. Discussing your concerns with a doctor can help you make the best decision for your health. Lifestyle changes can help reduce dependence on certain drugs, in many cases. Improving diet, exercise, and stress management can minimize the need for long-term medication use. Simple changes, such as maintaining a heart-healthy diet, staying physically active, and managing blood pressure naturally, can significantly reduce risks associated with certain medications. The importance of staying informed. One of the best ways to protect your heart and overall health is by educating yourself on the medications you take. Many people unknowingly stay on high-risk medications for years without considering alternatives. By having open conversations with your healthcare provider and staying aware of the latest research, You can make informed choices that support your long-term well-being. If you found this information helpful, hit the like button and share this video to help others stay informed. Many people may not realize the potential risks associated with their medications. Sharing this information could help them make better health decisions. Drop a comment below. Have you experienced side effects from any of these medications? We would love to hear your experiences and help answer any questions you may have. Your health is in your hands. By staying informed, asking questions, and making proactive choices, you can protect your heart and overall well-being. Make sure to subscribe for more health insights and stay safe.